Hello, hi, good afternoon, everyone. Thank you for taking your time off your busy schedule to join us in our lunchtime special webinar on promoting healthy aging in the COVID-19 era. Okay, so my name is Aiman and I'm from HMI Institute of Health Sciences. I'll be your host for today. Okay, so before we begin, allow me to go through some administrative details. The entire webinar will take about 1.5 hours. Okay, during the webinar, attendees are all muted. Okay, however, you can post your questions, if any, into our Q&A icon. You'll find it in the Zoom panel below. Otherwise, you can also use the chat function to post your questions. Okay, this webinar session will be recorded and published in our social media pages and also websites. Okay, so this webinar is brought to you by HMI Group and our community partners, Loving Hearts and SG Care. Okay, Singapore Cares, Jurong East. Okay, a little bit about HMI Group. Okay, HMI Group is a growing regional private healthcare provider with a presence in Singapore, Malaysia, Indonesia, right? And today's program is jointly organized by 3 of HMI Group of company: HMI Institute of Health Sciences, StarMed Medical Centre, and also OneCare Medical. A brief introduction of HMI Institute. Now, founded in 2002, we pride ourselves as Singapore's first dedicated private provider of healthcare training and education. Now, recently launched as a social enterprise, we are also accredited continuing education and training center by Skills Future Singapore. Now, committed to transform lives, we have helped more than 5,000 individuals to be trained in healthcare skills, and 3/4 of them are then placed in jobs. Okay, next up, we have StarMed Specialist Centre. Now, StarMed is a day hospital that provides high-quality private medical services at a comparatively affordable prices. Now, it was designed and managed by doctors with the ultimate aim to support superior patient outcomes. Now, our center caters to overnight admissions of up to 24 hours and is designed to offer a better alternative to traditional hospitals. Our core specialties are, okay, we have orthopedic, urology, colorectal, cardiology, gastrointestinal and vascular, digestive and liver, ENT or ear, nose and throat, pediatrics and general surgery. Okay, our multidisciplinary medical center occupies its own 11-story building and is conveniently located above Farrer Park MRT station and is next door to 300-room Holiday Inn Singapore Little India Hotel. Now, StarMed Specialist Centre is also a Medisafe accredited as a private hospital. Now, why choose StarMed, right? So diagnosis and treatment are provided by the same doctors practicing at leading private hospitals. Now, we focus minimally on invasive surgeries that do not require overnight stay, and hence patients can benefit lower costs at our medical center without night shifts or A&E admissions. Also, shorter stay reduces the risk of hospital-acquired infections, especially amidst this pandemic era that we're living in. Now, lastly, patients can benefit a seamless journey from diagnosis to discharge on the same day. Okay, that's StarMed for you. Okay, lastly, we'll talk about OneCare Medical. Now, OneCare Medical was formed in 2013 by a group of experienced doctors with a common aim to provide preventative, accessible, and professional healthcare to our patients and their families. Now, they are also a Medisafe accredited and CHARS clinics, as well as part of the MOH network of public health preparedness clinics, okay, during the COVID era. Okay, conveniently located in 24 locations all around the island. Okay, just to show you. Now, even for myself, I'm taking my booster jab with OneCare Clinic at the end of the year. So you can have all your needs, okay, taken care of by one of the clinics in OneCare Medical. So without further ado, on to our sharing session for today. We will have Dr. Jimmy Chu, okay, a family physician and co-founder of OneCare Medical. He's accredited as the family physician by the College of Family Physicians Singapore, and his area of interest includes chronic disease management, preventative health, and sports medicine. Right, so covering the topic of understanding gout. Let's welcome Dr. Jimmy Chu, please.
Hi, good afternoon, everyone. I'm Dr. Jimmy Chu. I'm a family physician and I'm practicing in OneCare Medical. So once again, I would like to take this opportunity to thank everyone for taking off time from your busy schedule to attend our webinar this afternoon. We hope that through this webinar, we can help everyone have a better understanding of some of the common conditions that we'll be talking about later. So my topic today will be on gout. There have been a lot of misunderstandings that we have been hearing around about gout, and a lot of our patients, we realize that they do not have a very full understanding of what gout is actually all about. So I hope that through today's session, I can shed a bit more light and perhaps answer some of the queries and clear some doubts that you may have on what exactly is gout. And we also go through how we actually manage gout and how everyone can take your own initiative to prevent this condition from happening. Okay. All right. So what exactly is gout? I'm sure a lot of you have heard of some other name that's commonly used. So in Chinese, you hear things like 痛风 or 高尿酸. So basically, gout is one type of arthritis. So arthritis is basically means that there's an inflammation in one of the joints in your body. There are many conditions that can cause arthritis, and gout is one of the conditions, which is why actually many people do confuse other kind of joint or even bone or muscle pain with gout. So gout is actually quite a specific medical condition. And how do you actually know that you have gout? Of course, you need to see a doctor to have a proper diagnosis. But typically, I will share with you the symptoms that a person can experience when he or she develops gout. All right. So gout is a sudden swelling that's red, hot, and it's very painful. And it happens in joints only. So it doesn't happen in your bone or your muscle, typically. Affected joints are mostly the big toes, all right? So that's the most common location. You can also have it in ankles, knees, your finger joints, and your wrists. And other joints, it can happen too, but it's not that common. And typically, it only affects one joint at a time, and it's usually on one side, okay? So I will show you in picture what exactly it looks like. So you see, this is the first toe, and typically it happens suddenly, all right? So it can just happen when you wake up and you experience this severe pain, and it can be quite red, very tender to touch, all right? And it's very typical that it happens in the toe, the first toe. So you can have it in other parts like your wrists, your finger joints, your ankles even, right? So it typically resolves over 1 to 2 weeks. And there will be usually no symptoms in between the attacks. Some people can get attacked once a month, some can get it once a year, or even once every few years, depending on how good or bad the control of gout is. So you want to know what exactly is gout? Why does it cause that kind of swelling and pain and tenderness, in that joint? And why is it that it's mostly in the joint? So basically, in a very short one sentence, gout is because there's too much uric acid in the body. And uric acid, so what is exactly uric acid, right? You will ask. So uric acid is actually the end result of a purine, which is part of the food that you eat mostly, that's being broken down by the body. And this uric acid is being passed out from the body through the kidneys and the intestine. So you can treat uric acid as like a waste product after being processed by the body. And so what exactly is purine? And where does it come from, right? So purine is a nitrogen-containing compound that's found in food like anchovies, your sardines, red meat, organ meat, sweetened food like soft drinks and dessert. And purine is also can be also found in our own body. That's manufactured by our cells. So these are also found naturally in our body. So when there's too much uric acid being produced, or too little being passed out, or usually it's a mix of both, this uric acid will form crystals, and these crystals will start to form around the joints or within the joint. And when these uric acid crystals form, they will cause a lot of inflammation. They'll trigger off the inflammation process in the body, and when the inflammation starts, you have a gout attack. So that is actually what causes a lot of pain and swelling and redness. So basically, in short, when there's too much uric acid, it forms crystals around the joints, and then when that happens, it causes a lot of inflammation, and then you'll get your gout attack. And usually, who gets gout? You will ask, right? We rarely see it in very young people, and as you get older, we will see more and more of these gout attacks happening in middle age, and usually they are men, more common than women. So for women, before menopause, it's actually quite rare that we see gout happening in women. And usually also is associated with metabolic syndrome. So metabolic syndrome is a triad of obesity, elevated blood pressure, elevated cholesterol. Okay. So we find that gout is actually largely a lifestyle kind related condition because of the food that you take, because of the activities level, and which is why it's also associated with the metabolic syndrome like obesity, blood pressure, and cholesterol. Okay. And so the next thing you want to know is how do we actually go about diagnosing gout? How do we say that this condition that you have now is a gout? So most commonly, when patients get this kind of severe pain, they will visit a doctor, and it's usually during these acute attacks that these sudden acute attacks that we can diagnose gout properly. So basically, gout is diagnosed through medical examination. Usually, it's done by a doctor. And remember what I mentioned in the first slide about how you present with gout. So that's how we diagnose gout, by looking at the symptoms. All right. So usually it's sudden onset, and then there's a severe pain and redness in one of the joint, and usually it's on one side of the body. And of course, there are some other things that can also help us with the diagnosis. So it'll be things like slightly high uric acid. Okay, but one thing to take note about for blood tests, you can't really diagnose gout purely through a blood test. The reason is because having a high uric acid alone is not diagnostic of gout. You have to have a gout attack. And if it's also associated with a uric acid that's high, then the possibility of a gout is higher. There are a lot of patients out there who has got high uric acid in the blood test. For example, when they go for health screening, one of the very common things that is being tested in health screenings would be uric acid. And some patients, they actually do have slightly elevated uric acid level in the blood, but they may not have a gout attack before. In such cases, actually, we won't consider the patient to have a gout. All right. So for gout to be diagnosed, you actually have to have an attack. X-ray is not very commonly used to diagnose gout. Of course, when the gout becomes quite advanced, you can actually see some signs from the X-rays. But most often than not, for most people, actually the X-ray finding is quite normal, and it's very non-specific. So sometimes you may see things like soft tissue swelling, but you may not actually see much other signs. And one other of thing that you can do is you can use a needle to aspirate some fluids from the joint, but this is actually rarely done unless there's really some doubts about the diagnosis of gout, or you're worried that there might be something else that's happening that's causing the joint pain, right? So because it's actually invasive, so it's actually quite rarely done, and it can potentially cause infection or bleeding. Most of the time, this kind of check where you take out the fluids from the joint is done in the hospital setting, and very rarely is done in our GP clinic kind of setting. All right. So next, so what are the complications of gout? So the complications of gout, from the first picture that you can see, is what we call the gout profile. You can see all these slightly yellowish stain, small bumps on the skin. Yeah, so it typically happens over the elbow area. It can also happen on your hands and of course your feet. So these are actually gout crystals. So as time goes by, as more and more gout crystals form, they can come out as such tiny bumps. So usually this means that the person will have gout for a very long time already, right? And of course, as more and more gout crystals deposit and from repeated cycles of inflammation, you can eventually get a damage in the joint that has been frequently affected by gout attacks. So uric acid, as you know, it forms crystals when there's a very high concentration of uric acid in the body, and this uric acid passes out through your kidneys. So if the uric acid becomes very highly concentrated in the body, you can actually crystallize and in the kidneys as well, and this will form kidney stones. There are many different types of kidney stones. So uric acid is one of the slightly less common kidney stones that you can get. And you can also get kidney failure. It's from a combination of taking too much painkillers for your gout attack, as well as having the actual uric acid causing the damage in your kidneys, and of course from the kidney stones itself, right? Okay, next, how do we actually treat gout? So now that we know what gout is, how we diagnose gout, and what are the complications of gout, so naturally we want to know how do we treat gout when a patient comes with severe pain, inflammation that is a sudden onset, right? So first of all, we want to make sure that we quickly stop the inflammation and the pain. So medications that we commonly use will be things like colchicine, NSAIDs like naproxen, Ponstan, diclofenac. Some of you might be familiar with these names. And for some patients, we also use steroid to reduce the inflammation. And also, you also have, once the inflammation is reduced, the pain is also reduced. So next, you need to rest the joint. Okay. So once you have this gout attack, do make sure that you do not continue to exert or overexert the joint. So if it happens in your feet or your ankle, make sure you do not walk around unnecessarily. Try to rest it. You can put some ice on the joint as well. That will usually help with the inflammation and pain a little bit. And of course, next, you must drink a lot of water. Why? Because remember, we said that uric acid is passed out through the kidneys, right? So if you drink more water, you help to pass out more of the uric acid through your kidneys. And of course, low purine diet, because as we know, gout is because there's too much uric acid in the body, and one common source of uric acid is from your diet. So during your gout attack, definitely you must take less of the diet that contains high purine food. And of course, next, for patients who actually get very frequent attacks of gout, we will need to consider long-term medications. So the medications that I mentioned earlier, like colchicine and naproxen, those are short-term medications that you take for probably 3 to 5 days while you're having the gout attack. But you don't take those medicine on a long-term basis. For long-term medications, usually these are needed, right, for patients who have start to have complications of gout, or when the gout attacks become quite frequent. And frequent will mean that maybe 2 or 3 times a year. Okay, so there are some medications that are available. So very commonly we use allopurinol, and there's also a second line drug that we use that's called febuzostate. But typically, the majority of patients, they do take allopurinol. When we first start these medications, you will realize that your doctor will often prescribe a very low dose of anti-inflammation medicine to be taken. The reason is because when you first start taking these long-term medications, there's a risk of getting more frequent gout attacks. That's because of how the medications is working to excrete all the gout, all the uric acid accumulated in your body over the years out of your body. So during this initial process, you may experience a bit more gout attacks. So to prevent that from happening, so you should need to take some anti-inflammation medicine for a short period of time, probably about 3 to 6 months. So once the medication has been taken for a while, usually will start to tail off the anti-inflammation medicine, and the patient will usually just continue on with the long-term medication. And very commonly we'll use the blood test to guide treatment. So one of the very useful thing for blood tests for the uric acid is that it helps us to have an idea of how well controlled the patient's gout is, right? So usually we'll aim for a certain level of uric acid level in the body to know that there'll be a very much reduced chance of having an attack once you reach that level. So next, prevention is definitely better than cure. So that's the first thing that everyone should do. All right. So if you want to prevent gout, so the most important thing is actually to take note of your diet. You need to make sure that this is especially for those patients who already start to have gout attack. You need to control your diet to have a low purine food. Later, I'll go through with you in a table to show you exactly what are the food that will cause gout attack and what are the food that are safe to take. And of note, animal purines, typically they are 5 times more dangerous than plant purines. What this means is that purines from animal products actually are 5 times more likely to trigger off a gout attack than purines from plants like beans and nuts. Okay, so all the red meats and your anchovies, your sardines, they are 5 times more likely to cause gout attack than actually your plant products. So always make sure you drink more water so that you can help with the uric acid excretion from your kidneys. And exercise do help with reducing your chance of getting a gout attack. But of course, when exercise, make sure you drink more water. Okay. And the next thing will be to lose weight. Increased weight has been associated with a higher risk of getting gout. And for patients who manage to lose weight, even though they are not taking any long-term medications to control gout, by losing weight, they actually get a lower chance of having a more frequent gout attacks. So controlling your weight is actually one of the important things of controlling a gout attack. And then last but not least, the patient will need to monitor for other conditions that might be associated with all these lifestyle related medical conditions. So this will be your blood pressure, your cholesterol, and of course your kidney function, because you know that gout can affect your kidney function. Okay, so this will be my last slide. So this is probably one of the slides that you will find quite useful. So these are the food that we have categorized into 3 categories to give you a better idea of what are the food that you should really avoid. So these are the category of food under high purine food. This is especially true for those patients already with gout attack, or from your blood test you find that your uric acid level is already on the high side. So you might want to take note. So these are the category of food where you want to avoid. So basically, those food from the sea, you want to avoid anchovies, sardines, mackerel, tuna, mussels, and scallops, right? And you also want to avoid crab, lobster, oyster, prawn, salmon. But these are slightly safer than your high purine category. And then for eggs, when you eat in moderation, it's actually quite safe. Yeah, so the other very big category of food that you need to avoid are all the organ meats products, right? Like your liver, your kidney, your pancreas. So this is from irregardless of whichever animal it comes from. So remember to do avoid taking too much of the organ meat. Okay, so beans, peas, lentils, these are your plant purine products. So they are less likely to cause gout, but they can still cause gout, especially if you also consume your animal purine products together with your plant purine products. So things like peanut butters and nuts, they are generally quite safe if consumed in moderation. Huh? Okay. So the next category would be fatty food, your bacon, your turkey, your venison, and all the very high fat dairy products. You also should avoid beef, pork, ham, duck, and chicken. For chicken will be the very high, the fatty parts of the chicken. So the lean meat product is slightly better. And your low fat and fat-free dairy products like yogurt, they are quite safe to take. So the next category would be your gravy, your broth, your chicken essence. So these are also actually quite high purine product food. Yeah. And then your plant products like spinach, cauliflower, asparagus, mushroom, they can cause gout attacks, but much less likely, right? So of course, all your other fruits and vegetables, they're actually quite safe to take. And then there's one actually very big category. So these are all your sweetened food. Actually, a lot of patients do not realize that sweet things, especially all the artificially sweetened food, they can actually lead to gout attacks. So these are things like your very sweet pastries, your desserts, your soft drinks. So that's something that many people may not realize. So do take notes, all right? So oatmeals and oats, again, they are plant purine products, so they are not so likely to cause gout, but they can still cause, right? And your potatoes, bread, rice, pasta, they are fairly safe. Next, we come to alcohol products. So beer is, among all the alcohol products, beer is the most likely to cause your gout attacks. So for those patients who have gout attacks, we will tell them to make sure that they take very, very minimal beer, so to avoid getting a gout attack. So liquor is also something that can cause gout, but it's less likely than beer. And for wine, if you drink in moderation, it's actually quite okay. Okay, so this is my last slide. Thank you for listening to this presentation on gout. I hope that through this presentation, everyone will have a little bit more understanding of what gout is and how you can actually prevent gout. I'll be happy to take Q&A in the Q&A session later on. Okay, thank you.
Thank you so much, Dr. Jimmy Chu, for the insightful sharing on understanding gouts. Okay, Next up, our second speaker, Ms. Phyllis Koh. Okay, she's a physiotherapist, a trainer in HMI Institute. She has more than 12 years of experience in various healthcare settings. She provides health therapy and healthcare-related trainings at HMI Institute, intermediate and long-term care, ILTC service providers, and also nursing homes. Right here to share with us regarding exercise, the key to healthy aging. All right, let's welcome Ms. Phyllis Koh.
Welcome everyone. Thanks for taking your lunch time to attend our talk this afternoon. The topic I'm going to share with you is exercise, key to healthy aging. Before I go into the topic of exercise, anyone know who is Jane Carson in the picture? Yes, she's Jane Carson, record holder for the world's oldest person. She died at the age of 122 years old in 1997, setting a record as the most long-lived person in the world. According to the report, she lived on her own independently from the age of 88 until about 110 years old, when she decided to move to a nursing home. Very few centenarians have delayed disabilities at late age, like Jane Carson. We regard these individuals as role models of healthy aging. What is healthy aging? WHO, World Health Organization, defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. Functional ability is defined as the capacity of a person to perform activity or tasks in their daily lives. Examples of activity for daily living includes like eating, showering, toileting, dressing, undressing, or even walking. So these are some activities that we cannot do without daily. The longer we maintain our functional abilities, the longer we can live independently. With this new concept, healthy aging doesn't mean aging without disease. Healthy aging means being able to do things that we need or value for as long as possible. Physical activity or exercise helps older person stay healthy and live more independently. Thus, staying active as we go older is vital. If we are able to keep up with the functional abilities, this can contribute to healthy aging. There are many health benefits of exercising regularly. They are one of the most supported by research evidence. For example, regular exercise helps increase or maintain muscle strength and flexibility. This is because exercise helps release hormones that promote our muscles' ability to absorb amino acid, which is protein. This helps our muscles grow and reduce breakdown. We start to lose muscle mass and function as early as around 35 years old onwards. Every year, we may lose up to about 1 to 3% of muscle mass due to aging. Thus, regular exercise is essential to reduce muscle loss and maintaining strength as we age. Exercise also helps to prevent or improve prevalent diseases among older elderlies, because lack of a regular exercise is one of the primary causes of several chronic diseases. Regular exercise has shown to improve, for example, insulin sensitivity and heart function. It also helps to reduce blood pressure and control cholesterol levels. And just now during Dr. Jimmy talk, we also heard about how it can help with the gout also, and especially when it comes to weight management. So regular exercise keep our lungs, heart, and bone healthy. Exercise, like for example, weight-bearing activities, help to keep bone strong by building or maintaining bone density. This also helps to prevent osteopenia or osteoporosis. Regular exercise help with weight management. Through exercise, we will optimize this metabolic rate, which help us to lose weight or maintain ideal weight. And helping with weight management, exercise will keep obesity-related diseases like diabetes and heart disease at the bay. Besides having physical benefits, exercise can also improve our mental health. Research has shown that exercise can improve brain function, protect memory, and thinking abilities. During exercise, there's increased blood flow to our brain and stimulate the production of hormones that enhance the growth of brain cells. So hormones like endorphins, which is our natural pain relief and feel-good substances in our body, are also released during exercise. Thus, regular exercise can improve our mood and overall sense of well-being as well. After walking through some of the benefits of exercise, what are the type of exercise we can do? There are different types of exercise we can engage in. For example, the first one, endurance exercise. Endurance exercise is what we call aerobic exercise. They usually work on larger muscle group. They can increase your breathing rate and heart rate. So there are activities like your brisk walking, your jogging, swimming, dancing, cycling, or skipping. The second one is what we call flexibility exercise. Flexibility training stretch your muscles and improve your range of motion at your joints. They are usually performed in a slow and controlled movements. For example, static and dynamic stretching and range of motion exercises. The third one is what we call resistance exercise. Resistance training increases muscle strength by making your muscles work against the weight of force. We cannot strengthen our muscles without sufficient loading. So sometimes we have to use different equipments for resistance training. Like for example, free weights, weight machines in the gym. We can use like TerraBands, resistance bands, or even use our own body weight as part of the loading. The last one is what we call balance exercise, which I think it has the least awareness. Balance training involves doing exercise that strengthen the muscles that keep you upright. So there are key muscles group that include your leg and your core muscles. Balance exercise can improve stability, joint and muscles reaction to surrounding, like your proprioception and coordination, which help to prevent falls and injuries. They play a very important role in fall prevention among elderlies as well. It's never too late to start exercise. Some physical activity is better than none. This is an exercise guideline recommended by Health Promotion Board, HPP. However, this guideline is generally for healthy adults 65 years old below without underlying medical condition. So for those who has any medical condition, please consult your doctor before commencing any exercise on your own. According to HPP, it is recommended for healthy adult to engage 150 minutes of moderate intensity aerobic activity a week or 75 minutes of vigorous intensity aerobic activity a week. You can also do a combination of moderate and vigorous activity. So this type of training we usually call circuit training or interval training. To maximize gain of health benefits, it is also recommended to include strength and balance exercise at least 2 times per week. That is excluding your 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise a week. For some of you, you may be wondering what is considered as moderate intensity aerobic exercise and what is considered as vigorous intensity exercise. For moderate intensity exercise, it should cause a slight increase in your breathing and heart rate. You should be able to talk, but not sing during the activity. You should be still perspiring. Examples of moderate intensity exercise are brisk walking, leisure cycling, leisure swimming, play double tennis, line dancing, or water aerobics. Vigorous intensity exercise will cause your heart rate to increase significantly more than your moderate exercise. So your breathing may become hard and fast during vigorous intensity exercise, and you may struggle to hold a conversation, most likely not able to complete a sentence. Examples of vigorous intensity exercise include jogging or running, swimming continuously, playing single tennis, playing any ball games such as like basketball or football, skipping, hiking uphill. You can monitor your intensity during exercise using a couple of methods. So one of the way is what we call talk tests. So it's a way to gauge exercise intensity based on the ability to carry on a conversation. So during a moderate intensity exercise, you may still able to hold a steady conversation with someone. For vigorous intensity exercise, only a few words are sustainable, most likely not able to complete a sentence. Another method is to monitor your heart rate using a smartwatch or heart rate monitoring devices. You can target your exercise intensity by calculating percentage or maximum heart rate. So if you are working on moderate intensity exercise, you should work at the estimated of about 65 to 75% of your maximum heart rate. For vigorous exercise intensity, you should work around 76 to 96% of your maximum heart rate. You can calculate your maximum heart rate by subtracting your age from 220. For example, if you are 50 years old, you subtract 50 from 220 to get the maximum heart rate of 170. This is the average maximum number of times your heart should beat per minute during exercise. Then you multiply 170 by 65%. That will give you about 110.5. This will be your lower limit of your moderate intensity of heart rate. Then you multiply 170 times 75%. That will give you 127.5. This will give you the upper limit of moderate intensity of heart rate. So you should monitor your heart rate at about 111 to 128 per minute during exercise. So for example, if you are working at moderate intensity and you are 50 years old, if your heart rate exceeds 128 during exercise, you should slow down. And if your heart rate falls under 111, you may pick up to stay at the target heart rate zone for moderate intensity. You can also monitor your intensity by measuring your rate of perceived exertion. The exertion is rated from 0 at rest with no effort to 10 the maximum effort. For moderate intensity exercise, you may target your perceived exertion at about the scale of 3 to 4, which is moderate to somewhat hard. Then for vigorous exercise at the scale of about 5 to 7, which is hard to very hard. Although regular exercise are good and beneficial, it's important to be safe during exercise as well. There are some tips for exercising safely. Always warm up first before you exercise and cool down after it. Your warm-up exercise should take about 10 minutes, which gradually warm your muscles and body to prevent injury. It should include the major muscle groups that will be used in your exercise. You can begin your warm-up sometimes with a low intensity activity, such as like brisk walking or steps. After exercise, you may cool down about 5 to 10 minutes, stretching muscle group you have used during your activities. This will help to reduce muscle soreness and stiffness. Also, get a good pair of comfortable walking shoes to have sufficient support to your feet, and wear comfortable attire. For example, lightweight and loose fitting clothes to facilitate heat loss easily. And also remember to stay hydrated. Drink before, during, and after exercise to prevent dehydration. Always start off slow, especially if you have not exercised before. Overdoing exercise can increase your risk of soreness, injury, and even burnout. Start at a light intensity if you are new to exercising. Then gradually build up to a moderate or vigorous intensity. Give your body enough time to adjust to the changes. For example, if you cannot do 30 minutes of exercise in one session, you can just start with 15 minutes of low intensity exercise a day. Then after 1 to 2 weeks of training and improvement, then you increase maybe up to about 20 minutes, or you can increase your intensity of exercise. So gradually increase your fitness towards your goal, not overnight. Always listen to your body. When your body is feeling something, it may be a signal to you. So take note if you experience any symptoms or discomfort during exercise. For example, shortness of breath, if you have like chest pain or body pain, or even have cold sweat or dizziness during exercise, please, you should hold on your exercise and monitor first and consult your doctor if your symptoms persist. Please consult your doctor before commencing any exercise program if you have any pre-existing medical conditions such as diabetes, high blood pressure, osteoarthritis, or heart disease. If you are 65 years old and above and have not done any exercise regime before, it's best to consult a doctor first to see if you are fit to start any exercise program on your own. You may also see a certified physiotherapist to advise on the suitable exercise regime to start with. For some cases, it may be necessary to exercise under supervision or direct facilitation of a certified therapist or exercise specialist to ensure your safety. I would like to end a quote from Dr. Kenneth Cooper, who is a preventive medicine pioneer and the father of aerobics. He introduced the concept of exercising to pursue good life in many countries. He said, "We do not stop exercising because we grow old. We grow old because we stop exercising." I hope this session will encourage all of us today to take charge of our health and adopt active living for a lifetime. Thank you.
All right, take charge of our health. Indeed, we will. All right, thank you so much, Ms. Phyllis Koh, for the insightful sharing. Okay, I would like to remind everyone that if you have any questions, you can post it using the Q&A icon in your Zoom panel, or you can use your chat panel to post in your questions. We will answer it during the Q&A session later. All right, next up, okay, our third and final speaker. Okay, we have Dr. Lim Chin Tat, a senior consultant and orthopedic surgeon at StarMed Specialist Centre. Now, Dr. Lim is a Singapore Ministry of Health accredited, USA Stanford University Hospital, and also UK Oxford University Hospital clinical fellowship trained orthopedic surgeon with a special interest in complex joint replacement, robotic assisted joint replacement, and sports surgeries. Okay, very interesting. And he's going to be covering the topic on common age-related joint issues. Okay, so let's welcome Dr. Lim Chin Tat, please.
Hello, good afternoon, everyone. I'm Dr. Lim. Thank you for logging on today to listen to the talk on promoting a healthy aging in the COVID-19 era. Let me get my slides. And today I've chosen two conditions to go through with everyone, one on osteoporosis and one on osteoarthritis. I've chosen this topic because it's very, very common. And we went through the talk by Dr. Chu and Ms. Phyllis, and it's all related to this, having some exercise, can prevent osteoporosis, active aging, and also gout can also cause osteoarthritis. It is very relevant in this era on COVID-19 because a lot of us may be staying at home to try to avoid the COVID, and that could have some repercussion, okay, and I shall go through with you in a while. Okay, this is me, I'm the medical director in the orthopedic practice and surgery as well as in StarMed. So today we will go through why it's important to talk about osteoarthritis and osteoporosis, mainly because there's an aging population as well in Singapore. We'll talk about osteoporosis. Do remember it's a bone condition because I have patients who come to me and they seems a bit mixed up between osteoporosis and osteoarthritis. Okay, osteoarthritis is a joint condition. Conclusion, okay, in Singapore, we are facing a rapidly aging population. 3 times the population age 65 and above will increase by 3 times from 2008 to 2040. Okay, the life expectancy is good, but what's important is the quality of life as well. Okay, active aging, healthy aging, gracious to age graciously. And reaching 100 years old is getting more and more common. You can see in the 1990s we have about 50 100 years old citizen. And now we have about 1,200 100 years old citizens in Singapore, which is really good because the quality of healthcare is really good. So what is osteoporosis? I mean, we have WHO, World Health Organization classification. It's too complex, okay? So no need to read this. It is a condition where the bone structure is abnormally porous. That means in the bones, there's a lot of holes, okay? And the next slide, you understand why this causes the strength of the bone to be lower than normal. So this is on the left, it's a normal bone. You can see there are very few holes in the bone. On the right, there are many holes. And these are microarchitecture, so you cannot see in the naked eye. The bone is still as big as possible, it's just not as dense, okay? So it's a silent disease. Primary osteoporosis, very common. We call it primary because there's no known cause, okay? So in the female, around menopausal period, and the male, fortunately, a bit later, 10 to 15 years later. Many people also brush it aside, okay, is it a OH disease? But unfortunately not, because they are secondary osteoporosis. Example, patient with long-term medical problems like renal failure, liver disease, patients with a higher level of thyroid hormones, patients who develop early menopause, and patients who are on steroids and chemotherapy medications. Okay, this patient develop osteoporosis earlier. Okay, earlier. So this is something that we need to take note. Diagnosis is not difficult. It's a silent disease. So we need to do certain scans. Okay, is what we call a BMD DEXA scan. Dual energy X-ray absorptiometry. Okay, it's easily done. We scan the spine. You can see the first picture here is one scan of the spine and one scan of the left hip. It's quick, it's accurate, and involves very little radiation. It's the gold standard where we can actually compare to our Singapore population. If you go for a scan, take note of these few words. You're either normal, which is good, osteopenia, so you're on the lower side, or osteoporosis. Okay, osteoporosis means you already have the condition, which is not so good. X-rays features, there are some X-ray features, but these are more for the medical professional. Some of us, the more experienced doctor, when they look at the X-ray, they may see that, hey, the X-ray doesn't look normal. It looks thin, it looks like they may have some osteoporosis. Okay, so then they will order the X-rays. Something very interesting, pig bone mass. I think just now Phyllis also talked about pig and muscle mass. So there's also a pig bone mass, okay? So it happens between 20 and 30 years old, okay? So this is really important. So it's something that we need to achieve, okay? To achieve as high as possible pig bone mass. It remains high. If you are 40 to 50 years old, you can see the chart. So for male, we normally reach higher pig bone mass and female a bit lower. But for female, you can see the dip in the bone mass during menopausal, but the male will dip slowly. Okay, so failure to attain adequate peak bone mass is one of the main reason, or one of the main factor for osteoporosis. In other words, again, it's not really a condition for old age. It's something that younger patient can do something to avoid it, which is to try to achieve a peak bone mass by having good regular exercise, weight-bearing exercise in the sunlight. And important to take note for women and menopausal is really deteriorate really fast. Okay, you lose bone mass about 3% a year versus 0.3% a year in the previous decade. So it speed up 10 times faster. And this is due to hormonal changes. I think the first thing I want to write there is a silent disease. Okay, so osteoporosis is a silent disease. Okay, so screening is important. Some develop back pain and increased hunch and diminished height, but this is too late already. That means there's already some severe form of osteoporosis and your spine is actually giving way. I think it's far too late to wait for these features. There are some risk factors for osteoporosis. The non-modifiable, which we can't do much, like low body weight, elderly age. Okay, so what is more important is to identify the modifiable. That means you can actually do something to change the osteoporosis. Cigarette smoking is bad. Alcohol abuse, low calcium intake, lack of a regular physical activity. Okay, so we should do moderate or vigorous activity to mitigate the risk of osteoporosis and prolong immobilization. Very interesting. You can Google this. Okay, fracture risk assessment tool. So it's something that you can actively put in the numbers to check. Okay, you can put in your age, your gender, your weight, whether you have previous fracture, etc., 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 and you can find out your risk of fracture in the next 10 years. But to do this analysis, you need to have a BMD scan done. Okay, so you can put in the numbers here. I mean, it's just interesting to see what is your risk of having a fracture in the next 10 years. It calculates the probability. And it's actually tagged to the Singapore population. So you can actually key in different countries to see in the different risks. Treatment, I think first and foremost, I always tell patients to modify the risk factor, reduce alcohol intake, stop smoking. Okay, that's the first thing to do. Exercise and diet, okay? Increase your calcium and vitamin D intake. So this is the recommended dietary allowance, okay? So about 1,000 milligrams of calcium a day and 400 units of international units of vitamin D a day. Food, calcium, a lot in milk. You can see the milk give a lot of calcium, but not really in other form of food. Some side effects like kidney stone, bloatedness, so you have to drink a lot of water if you take a lot of calcium. Vitamin D, okay, this is the one that's really difficult because I find that it's very difficult because it's found in very few food, okay, and cod liver oil, they have a lot of vitamin D, but unfortunately, I think in our local context, we don't really take a lot of cod liver oil, and it's also in high quantity in the fish, it's like salmon, mackerel, which I don't think we take a lot as well, okay, so in the end, end up with sunlight exposure, okay, that's important, okay, this is really important, so you have to expose your hands, your face, and arms for about 15 minutes a day. And without sunscreen lotion. Some patients will do it with sunscreen lotion, but it defeats the purpose. If all fails, we reach osteoporosis medication, and I really think this is not the platform to go through this because it's very complex. And normally, if a patient has this, I will normally get them to see an endocrinologist, okay, to manage the osteoporosis. Okay, and why we so worried about osteoporosis? Because even though it's a silent disease, because it can cause fracture, wrist fracture, spine fracture, and hip fracture, and that's why, take a message, that's why we have to take note of to avoid osteoporosis. Okay, so this is just a quick summary of osteoporosis. I want to share a little bit about osteoarthritis. Again, it's an aging population, and a lot of patients will develop arthritis as they age. This is a diagram of a knee. We have the ligament. Okay, this is the thigh bone is at the top, the tibia bone is at the bottom. Okay. So we have a meniscus, which is the cushion between the two bones, and we have the cartilage, which is the lining of the knee joint, okay? So when you have osteoarthritis, you have wear and tear of the cartilage, okay? I'm going to use the knee joint to talk about arthritis. So it's a degenerative condition of the joint with thinning of the cartilage. Again, there's primary condition like with no known reason. That means as you age, you just develop arthritis. But there are some patients who develop arthritis earlier. Again, okay, it may not be old age disease. If you have previous fracture, if you did a previous surgery, or has a previous injury to the knee, or if you have a gout, Okay, like what Dr. Chu said, if it's uncontrolled gout, they can actually attack the joint and cause osteoarthritis. And that's why we have to identify and treat the gout well. Pain, swelling, stiffness, deformity, and weakness. Okay, these are the common features of osteoarthritis, be it the knee joint, the hip joint, or the ankle joint. Okay, and there are always good days and bad days. So I always ask the patient, do you have more good days or more bad days, to gauge how bad it's affecting their quality of life. Unfortunately, the natural history of arthritis is that you wear and tear will progress, okay, because this is part and parcel of aging. I mean, we normally tell patient you will progress, but the question is how to slow down the degeneration, okay, and later we will go through that, okay. The question is how to slow it down and not how to stop degeneration. So treatment option also for prevention is conservative, so the majority will do well without surgery, of course, okay. So weight loss is really important in the prevention of osteoarthritis. When you squat and when you jump, the knee sustain about 7 times the body weight. So if you lose 1 kg in the weight, you lose about 7 Newton of stress in the joint. Okay, lifestyle modification, less climbing stairs, less squatting will help. Knee guard plus minus. Physiotherapy is important, so that's one of the things that I tell patients to do. I mean, at least go for a few sessions of physiotherapy if they have a knee problem or osteoarthritis. I will normally treat them with some topical medication like gel or plaster to reduce the inflammation. If it fails, then we top up with some medication, and we can give knee injection as well. There are many options, and if all fails, sometimes I also get patients to use medical aids or essentially just a walking aid. So there's some myths that I also like to correct here. Okay, so a lot of times I give patient medications, okay, to treat the osteoarthritis, but a lot of them wouldn't take, and then they'll come back to me and say he or she didn't take the medication because it's addictive. They don't want to develop dependence, and it wouldn't work if they take too much. Actually, a lot of time, this medication like Celebrex, Acoxet, they are anti-inflammatory medication, and they are definitely not addictive, and they are not painkiller. They're actually medications to reduce inflammation. Okay, so they are really good. And plaster and gel, they are the same component, about the same medication, but plaster and gel has less side effect. So after a course of oral medication, I will switch it off and switch to a topical medication. Do remember that these are anti-inflammatory medications. If your doctor gives it to you, you should actually take it for a few days. Okay, you won't be addicted and you won't develop dependence on it. Myth number 2, okay, glucosamine, chondroitin, a lot of all this medication in the market. Okay, so they are anti-inflammatory, they have some pain relief component, but in fact, evidence is not ideal. Okay, they are not good. The cost is not too bad because there's some generic glucosamine around, and the risk if you have allergy or if you are diabetic, because there's some sugar inside, so sometimes it may affect the diabetic control. Okay, so it may not be that useful. Again, in terms of supplement, I normally don't advocate giving supplement. I mean, if it's so good, then there should not be much of a problem now. Okay, but there are very poor evidence. Gel injection, these are some gel injection, like 3 injections of 2 ml in gel. They are done easily in a clinic. Over in 10 minutes, you can walk and drive for the same day. This gel component is like lubricant, so they don't have a permanent, it's not a permanent solution to the problem. I would say that sometimes I do give it to the patient. Example, they are going for an overseas trip and they have some pain and which they want to control it so they can have a better trip. So I mean, these are okay so long they understand the risk that there's a small risk of infection and it doesn't treat the underlying problem. That means the knee pain will most likely recur in months or even 1 year. Physiotherapy is very good. Okay, it's one of the really proven recommended treatment for osteoarthritis. Okay, on top of weight loss and taking the anti-inflammatory medication. So in fact, these are the 3 non-surgical treatment that have proven: physiotherapy, weight loss, and anti-inflammatory medication. Some walking aid. So a lot of patients are also resistant to walking aid. I think some of them are not so, they don't want to attract unnecessary attention. So I recommend getting an umbrella. Okay, but with a proper stopper. You can see this picture. There's a proper high friction stopper at the bottom so that they don't lead to fall. The last resort, the very last resort is operation. Okay, so we always weigh the risks and benefits. The benefit is that it improves the patient function, reduces pain, reduces stiffness, but there's always a risk in operation. So there are many options. For younger patients, we just do a keyhole surgery to try to preserve the joint. For older patients, we can do a half knee replacement, a full knee replacement, or even a robotic assisted knee replacement. It is a keyhole surgery for younger patients where they don't want to replace the whole knee. That means they don't want to take away the whole knee and get an artificial knee. It's easily done. We can see the cartilage is all damaged, is all rough. This one there's a hole and there's a bigger hole. There's even a bigger hole in this patient. So we can do some trimming and some polishing again. For the meniscus as well, this is a thigh bone, this is a calf bone, and then this is a meniscus. This is a good meniscus and this is a torn meniscus. We can put in a punch to go in and trim it up. Okay, it's easily done. They stay overnight and they can go home the same day or the next day. Alternatively, if the patient is slightly older and the joint is really bad, we replace the joint. We can do a half knee replacement or full knee replacement. So example, in this x-ray, you can see the joint is damaged on one side of the knee. There's a bone and bone in contact. Okay, this is the thigh bone and this is the calf bone. So what we do is we replace the damaged part of the knee by putting a metal and some implant in so that the bone and bone doesn't come into contact. This is a full knee replacement where you see the joint damage is really severe. So we do a full knee replacement where we cover up the entire knee with metal. So myth number 3, a lot of patients don't want to go for the surgery because they feel that there's a limited lifespan. After a few years, they will get a call to come and get a new knee. But it's not. It doesn't work like that actually. In the biggest registry in the United Kingdom, where there's 1 million knees replaced, the survival for it is 15 years, and 95% of the knees have survived beyond 15 years. Okay, so most of them will last for 20 years, 20 plus years, but we are still monitoring the progress. So we can use a robot to do the surgery with us. Okay, you still need a surgeon to guide the robots and the robots to assist the surgeon. And now we have for knee replacement, also a lot of patients also feel that they will need to be bed bound with a lot of pain after the surgery. But in fact, we have a good pre-op care around the surgery and after operation care to make sure that the pain is well controlled, to make sure the dressing is good, to make sure the wound is good. And a lot of time for my patients, they'll be walking on the same day and they have to be walking. I'll tell them that I'll do the surgery in the morning and I'll come to walk them in the afternoon. Okay. Some take-home message. Osteoporosis is a bone disease, okay? So the so-called supplement associated with osteoporosis is calcium and vitamin D. It's a silent and serious disease. Sunlight, exercise, and diet. Sunlight, exercise, and diet will do wonders, okay? And routine screening may be important, again, because it's silent, okay? It's a joint disease for osteoarthritis. It's important to come up with the correct diagnosis. We always start with non-surgical treatment like physio, weight loss, and some medications. And if you do end up with surgery, there are different types of surgery like the keyhole surgery, half knee replacement, full knee replacement, or even a robotic surgery. Okay. Thank you, everyone.
We have upcoming programs that's lined up for you. Okay, and as you can see here, the QR codes, please scan them. You can find more information on a caregiver training course, transit into healthcare career. And follow us on HMI Institute on social media and also StarMed on social media here. I'll flash this QR code again at the end. Okay, to find out more about us or if you have any inquiries, please scan the QR code over here to HMI Institute, StarMed Specialist Centre, OneCare Medical, and also not forgetting our community partners, Loving Heart and also SG Cares Jurong East. Right, so we come to the end of the session today. Thank you, everyone, all our speakers, our attendees today. All right, it's going to be a nice weekend. So enjoy the holiday and festivities and have a great week ahead. Thank you so much, everyone. Take care. Bye-bye.
Bye-bye. Thanks.
Thank you so much. Bye-bye. Thank you, Dr. Lim. Thank you, Ms. Phyllis. Thank you.